We're here at Magee Women's Hospital with Operation Walk. This is the second annual event for the group in Pittsburgh, and we're talking with Dr. Brian Hamlin. Dr. Hamlin, can you tell me how you got involved with Operation Walk?
Well, about a year ago, Tony DeGioia, who was the founder of Operation Walk Pittsburgh, asked me to participate and to also contribute for Operation Walk Pittsburgh, which is a local home event for what's really a national organization. So traditionally it's been a program that has provided arthroplasty surgery or joint replacement surgery for patients with arthritis of the hip and knee in third world countries. So places where they don't have resources, they don't have physicians to provide these opportunities. And the idea grew partly from within the organization, but also from our own patients in Pittsburgh that we asked to give to help fund Operation Walk that goes to places like Guatemala or Panama. That, why don't we do something at home? And so from that, we actually last year, for the first time, did Operation Walk Pittsburgh, where we provided that same service to patients who are unable to have resources to have hip and knee replacement surgery, but provided it here at home in Pittsburgh. It's kind of coinciding with the Thanksgiving holiday, which we think sort of makes sense to provide this to these patients who need this type of health care. The decision has been made to kind of offer it this week or right around the Thanksgiving time, and actually now it's actually turned into a national program. So there are actually patients across the entire country, either this week or next week, who are getting essentially free care for their for joint replacement, again, of the hip or knee. And what our program does, specifically here in Pittsburgh, is identify patients over the past 6 months to a year who can qualify for this program. They have to meet certain criteria, and if they meet those criteria, then they're able to pursue care within this type of program. And so typically, initially, they get one assessed to make sure that they're a candidate for joint replacement surgery, that they've failed conservative things, so things that we can do other than surgery to try to help their problem. But when they get to the point where their arthritis is bad enough and that they've failed other measures, then we offer them surgery, which is the way we treat our patients who have resources also. And then we have one day that we spend in the operating room where we perform the surgery. Myself and Dr. DeGioia provide our services as surgeons in terms of both their perioperative care in terms of doing the operation and then their care post-operatively. But then Magee and UPMC provide all the other support, the nursing support, the physical therapy support, the home health service support, so these patients can have the full breadth of care, not just the surgery, but the full breadth of care until they're fully recovered from their operation.
Tell me how many people are involved with Operation Walk to make this event happen here in Pittsburgh.
Sure. The number is really hard to count. I mean, there's probably upwards of 100 people, truthfully, who help. There's a lot of work that gets done to fundraise throughout the year for Operation Walk that goes overseas, but there's also a lot of work that's done locally to get the patients ready for surgery. So it's everyone in our office staff, which number 15 to 20 people, the OR crew numbers 5 to 10 people, the anesthesia crew, the nursing staff, the physical therapy staff, and it's really it's amazing, actually, that all these people, and then all these people are essentially giving their time freely to provide this care for these patients. I think it says a lot, really, about us as caregivers, that it's not always all about the dollar. It's really about providing what's best for our patients. That's what this is about. So it's probably why we all originally went into this, is for these kind of things. It really makes you feel good about what you do.
And since this is the second class for Operation Walk, tell me about the initial patients. How are they doing?
Well, it's interesting. Had a nice surprise today we're having a little bit of a kind of a pre-Thanksgiving celebration of providing the care this year. And the patients from last year actually came back today to let us know how they were doing. And they're actually all doing fantastic. And it's nice to kind of catch up with them because we haven't seen them for a while, since it's been a while since they had their initial surgery. And it's nice to see them all walking and smiling and telling them expanding on what they're doing now, and that they're enjoying their ability to walk and live life and do it without pain.